Hi, my name is Ayan Loal, and I am the Community Engagement Program Officer from the Centre of Migrant, Refugee and Health. And we have here Adil Tat. In today's session, we are going to be mainly talking about, so this is a health chats project for young people. So the main questions like we're going to be looking into today is like to see whether people or youths value the COVID-19 vaccines. Why does it matter to them, your family and the community? So yeah, I'm also going to allow Adia to introduce herself and we'll take it from there.
Thank you, Ian. Yes, my name's Adil Tat. Living in Melbourne, Australia. I've been working in healthcare for almost 2 years. I'm currently employed with Eastern Health as a registered nurse. So thank you for inviting me on your platform.
That's absolutely amazing, and yeah, we are really happy to have you here today on the live stream. The main reason we decided to have this live stream or this session is basically we know there have been a lot of youths that you know or a lot of rumors that are going on with the COVID-19 vaccination, and people some, not all people, but some of the youths probably do have the fear of not taking the COVID-19 vaccination. And that's why we want to provide them with enough information about the COVID-19 vaccination. And yeah, hopefully they'll be able to take those who have the fears. Hopefully they'll be able to, feel safe again and get the vaccination. So today I'm going to provide more information about the COVID-19 vaccines through HealthChats. So HealthChats is a project for young people. HealthChats is a project funded by the Federation of Ethnic Communities Councils of Australia to address issues of COVID-19 vaccines hesitancy for young people in Victoria. So before I continue, I would like to ask you, Adil, how have your experiences been with COVID-19 and the COVID-19 vaccination? And did you get vaccinated, or what are your concerns or fears?
Yeah, no worries. So with the COVID-19, I mean, it's been almost 2 years since we've had the virus. So it has impacted, being close with family and friends. Yeah. There's been some distancing and a lot of fear when it first happened. It was a bit of, some panic. And then with everything shutting down, it was very lonely for people, I'm guessing. Yeah. And then with the COVID vaccination, I think it just provided a good opportunity, and it did put people's anxiety at bay with the virus, at least that there was an option to get to have some form of protection, which was good. I myself have been double vaccinated. I do work in healthcare, so I am at, working with people who are at high risk and sort of immunocompromised. It's very important that I get vaccinated. Yeah. So my experience with it was, I was just as anxious as anyone else. It's been, years since I've been vaccinated because I don't travel a lot, and I'm now a young adult. So it's been a long time since I've had to get vaccinated. And, when I was, it was with my family and my parents were there. But with it being such a world, epidemic, and it's always on the news, you do get very fearful of things, especially because it's very new. You've never had something like this broadcast every day on news and social media. So when I first got the vaccinated, I did get a sore arm, and I was a bit, tired. But after a whole day, I didn't really experience anything. I was able to go back to work. And also with the second vaccination, I didn't get any symptoms at all, which was very good.
It is okay, to be anxious and fearful, especially it is, like a pandemic and it's something new. Like for me also at the beginning, I was really anxious and really fearful. And with the COVID-19 vaccination, I was actually fearful to get the COVID-19 vaccination. I think I would say to myself, my concerns were okay, what was in the vaccine? What were the side effects of the vaccine? And But at the end of the day, like I decided to get the vaccination, so I have been double vaccinated, and the reason is mainly to protect the community. Yeah, because we have been in lockdown like for too long, and I felt like being in lockdown like isn't the solution. Like
Mm.
solution for the of course we're gonna probably live with COVID-19, and there are also other variants that are that are arising out there, like the like the other variants. So
Yeah,
yeah,
yes, yes.
yeah.
Yes,
So
yes, I agree with you too. Yeah.
yeah, so I'm going to just provide more information about
Mhm.
the COVID-19 vaccination, and if you do have any concerns or any questions that you want to bring up, feel free to do so. So yeah. So please, I would like you to listen to this important information about COVID-19 vaccines to young people living in Victoria. So it is not okay to accept this message if you think it is not important for you. So since COVID-19 pandemic outbreaks, there has been circulating myths and misinformation about COVID-19 vaccines on social media outlets that have resulted in a high level of COVID-19 vaccines hesitancy among young people in Victoria. So you should know there has been scientific breakthrough about the discovery of the COVID-19 vaccines to treat COVID-19. So Australia has managed to date to implement public health measures, including restrictions whenever there are outbreaks, contract tracing, including case and contact tracing, testing, isolation, and quarantining for close contacts and outbreaks management in workplace. So COVID-19, as we know, is a dangerous virus. It can spread quickly from one person to another, and it can make you very sick and even take your life. So yeah, the Australian government has made the COVID-19 vaccines available for all people in Australia, regardless of whether you are an Australian citizen, permanent resident, or hold a temporary visa. So the COVID-19 vaccine provides everyone with protection against COVID-19 virus. So yeah, so in partnership with the Australian Federation Government, the Australian state and territories are helping to provide the COVID-19 vaccines that have been approved by the Therapeutic Goods Administration, so which is Australia's medicine regulator. So basically what it's saying, like these COVID-19 vaccines had been approved, by Therapeutic Goods Administration, like before they are given out to people. Yeah. So so they are safe, and they also provide effective protection against COVID-19. So there is going to be an information pack available in English language and in a range of other languages to help you understand COVID-19 vaccines. So together with the Australian government, we are working hard to protect your health and the health of others, helping to deliver safe and free vaccines that are a key part of keeping us all safe and keeping Victoria open. So I want to provide you with accurate information about the COVID-19 vaccine. So the COVID-19 is a real virus that has caused hundreds of deaths in Australia and millions of deaths globally. It can make anyone sick and is easily spread between people. So Australian testing kits can detect this virus, and they are very accurate. The vaccines help your body to develop immunity against the virus. By getting vaccinated, you protect yourself and your community against COVID-19. Even if you even if you do catch COVID-19, you are much less likely to get very sick and need to go to the hospital or lose your life. So yeah, there have been people that were concerned, especially with the COVID-19 vaccination. Like once they do get vaccinated, are they going to get COVID? Yes, they could get COVID, but
Mhm.
let's say the severity of the COVID-19 is not going to be too much compared to
That's
someone
true.
who's not vaccinated.
Yeah, so
Um,
if you do get the vaccination
yeah,
and then you do contract COVID, because you still
hmm
are at a risk of contracting COVID, it just lessens the effect. So if you are
yeah,
end up getting contracted, then you're not going to be having those severe side effects of
Yeah.
COVID as you would if you weren't vaccinated. So I have
Yeah.
heard people raise those concerns. I've had a
Yeah.
sibling raise that concern as well.
Hmm.
So it's good to straighten that out, that if you do get vaccinated, you don't get COVID from the vaccination. You're just
Yeah.
at lesser risk of getting bad side effects of the actual virus.
Yeah. Yep, that is really true there, Adele. So, okay. So, so the COVID-19 vaccines are safe and they have been tested in tens of thousands of volunteers in studies and meet high safety standards. They have already been given to millions of people around the world. So it is your choice to receive the COVID-19 vaccine. This year, vaccines will be available for free to anyone aged 16 years and older, which has already happened at the beginning of the year. So, and we're almost towards the end of the year. So, all viruses can change over time and make new strains, but the more people who get vaccinated, the higher the immunity in our population. In our population, the better chance we have of preventing ongoing transmission of COVID-19 and preventing further mutations to the virus occurring. So, current COVID-19 vaccines are effective against a range of new variants. And of course, we have heard, the new variant, is it the Omicron variant, which,
Yes.
yeah, yeah, so, the vaccines available in Australia meet very high safety standards. So, it is impossible for these vaccines to alter or change your DNA. So, once the vaccines has helped your body make immunity against COVID 19, they are quickly broken down. So, by this, it kind of means like, once you're immune to COVID 19, the COVID 19 vaccination is going to break down. So, it's not going to like stay in you for long term. I hope that makes sense. So, there is a question here that which vaccines is more effective than the other. So that question is coming from Mabor Major. So I would say basically all vaccinations, starting with the Pfizer and the AstraZeneca and the other one Moderna. I think all of them are effective. So all of them would work. So I wouldn't say that this one is more effective than the other. I think all of them are effective from my understanding. So
Yeah, I think with all of them too, it depends on the person. If they're immunocompromised, older age, they may be recommended to get booster shots. I know,
yeah,
especially older Australians are recommended to get it just because they're already at a disadvantage. They've just got risk factors that mean that they may have to do the booster shots. And I believe also if you work in like a healthcare field, you may have to get booster shots, especially if you're working on a COVID ward.
yeah.
Yeah.
Okay, yeah. And also, like with the AstraZeneca, is it AstraZeneca? Like the pronunciation, sorry. It's a bit hard to pronounce. So with that vaccination, I think it was for people above 60, the elder people.
Mm-hmm.
Yeah, and the Pfizer, and I think the Pfizer was,
Madura.
yeah, Moderna was for those below. So yeah, so yeah. But I think people can get, AstraZeneca, Pfizer, or Moderna. So yeah, it doesn't matter which one they choose to take.
Yeah,
Yep. So
I've had people in my family take. Well, it's either I think Madura when my brothers took that, and someone else took the Pfizer vaccination.
yeah,
So
yep.
yes.
Okay.
But yeah, I think it's good to just discuss with your doctor if you're not very sure of
Yeah,
which one to get,
yep.
because there are. Yeah, it's just better to consult medical
Medical advice. Yeah,
profession, especially
yeah,
if it's someone that knows your medical history. If you're
yeah.
anxious about the side effects or which one's more appropriate for you.
Yeah, and of course, some vaccines can have side effects, while
Yes, yes.
like minor side effects. and some people may experience them, some people may not. So it depends on their, their immunity, or their body. So if you have previously been infected by COVID-19, you should still get vaccinated against COVID-19 to boost your immune system. So no one knows how long immunity lasts following vaccination, but we also don't know how long immunity lasts following COVID-19 infection. So any vaccine can cause side effects. So most side effects of the COVID-19 vaccines are, are expected quite mild and are signs that your immune system is responding to the vaccine. So just in case you do get, any side effects from the COVID-19 vaccine, just know that your immune system is responding to the vaccine. And I find that a pretty good thing. So yeah. Okay. So okay, we are just gonna take a little bit of a break, and hopefully we continue from there.
Yep, no worries.
Okay. Sorry. Sorry.
Yeah, all
Okay.
good.
Sorry about that. Yeah. So we are back. That was a short break, but yeah. So but we're gonna be finished soon anyway. So yeah. So so any vaccine can cause side effects. So most side effects of the COVID-19 vaccines are expected quite mild and are a sign that your immune system is responding to the vaccine. So they include tiredness, pain at the site of the injection, headaches, fevers, or chills. So these expected side effects usually disappear after 1 or 2 days. After a day or two. So the COVID-19 vaccine does not contain milk, egg, pork, or any pork products. They do not contain any microchips or software. You can find a complete list of the ingredients of the COVID-19 vaccines on the GA website. It is impossible to get COVID-19 from these vaccines. So we can all help protect our families and friends and community. COVID-19 infections are disrupting our community, including people not being able to gather, go to work, or go about with their daily lives. Sorry, oops. Yeah, to go about with their daily. Sorry, I feel like I can hear my echo.
Echoing?
Yeah, that's just
Oh,
a bit.
I can't hear it.
Sorry. Yeah, I could hear it from my side anyway. So, um, yeah. So, like the COVID-19 has like really affected, our community. So, people were not able to go to work or gather and even go about with their daily lives, like which has been really stressful, to a lot of people. So, that's why we do encourage, people to get the vaccination and so that can resume, which has already, has resumed. People are able to, go back with their daily lives, but and also, just to have that immunity and that safety, like to provide a lot of more safety, more safety to the people.
Mhm.
Yep. So there is a question here also, like, how would you advise young people to get vaccinated?
So myself, on the Department of Health, there is you can put in your postcode, and it can actually bring up locations where the vaccinations are occurring.
Yeah,
Most of them are happening at GPs. There are like a pop-up locations,
yeah,
and also pharmacies are doing it as well. Some hospitals are doing
yeah,
it. So you don't have to travel a distance, but if you do some research, you can find that they're not very far from where you are. They Most of the locations are near public, transport, so it's not in an isolated area. You shouldn't have trouble
yeah,
getting vaccinated. But myself, I've gone to my local GP and just booked in an appointment, and that's how I've gone about it.
yeah, yeah, yeah. That's true. So, there is also another question here for you that is coming from. Okay, so Adil, advise us about the perceptions and myths on COVID-19.
Hmm. So some of the myths that perceptions I've heard is some of the things that you listed about, animal products being in the
Yeah,
vaccinations, which aren't there. A few myths I've heard is that if you do get the vaccination, you are going to get COVID-19, and that's, I
yeah,
guess, implying that the COVID vaccination is the virus, which is not.
yeah,
Um, some of the myths is that if you do get the vaccination, that you are now, exempt from actually ever getting the virus. It's just
yeah,
a defense system, and it's a way for your immune system to know that this is a virus, and it sort of trains your immune system to, to defend itself when it does get contracted with the virus. What else? And the COVID-19 virus is real. I've heard some myths that it's not. It's a virus like other viruses that we get, things that just
yeah,
impact us, and it can be very serious for people, especially if you're already sick. So
mm-hmm.
it's very good to do your research, and seek medical advice if you're not too sure whether to get it or not. But yeah, it's a virus, and it's been fatal to some people, left serious health concerns, and left a lot
Yeah,
of people in hospital. So that's some of the myths I've heard.
yeah. And I've also heard, like, I think a myth that some people think that COVID-19 is not real. Like,
Mm.
it doesn't even exist. So it was probably created in order for the government to keep people indoors or to keep people in lockdown, you know? So
Mm.
on my perspective, COVID-19 is real. Like, I have had, extended family or relative that has had contracted COVID-19, and, it had been like a really difficult experience for them.
Mm.
So it is real and it is out there, and yeah, it's probably still gonna be out there and still gonna live with us. And it is important that we get vaccinated and protect our community and our loved ones. So yeah. So how many? Another question. How many young people? How many young people that got vaccinated so far? Like approximation. So
Well, my numbers may be off, but I know that when it was above 16, they were trying to
yeah,
aim for over 90%, and
yeah,
then they were going to mandate that people get the COVID vaccination certificates to be able to enter facilities. So I
yeah,
think it is over 90%, because I know that people who are over 16 are being asked to show COVID-19 clearance or certificates. And I think it may also be the same for people who are over 12 years old, that now, because there's over 90% people vaccinated who are
yeah,
over the age of 12,
yeah,
now they have to show that they've got proof of vaccination. So I think the numbers are very high for people who are
yeah,
vaccinated,
yeah.
even young people. Yeah.
Okay, and that seems really good. Yeah. And also, is it true that another question that is coming from the Facebook Live from Mabor Mature?
Mhm.
So the question is it true young people from South Sudanese background are hesitant about COVID-19 vaccination?
Uh, I think the group of South Sudanese are a little bit all hesitant, but we've got a lot of different
Community. Yeah,
multicultural community
yeah,
groups that are very hesitant.
yeah,
So I think with the young people, my experience, just because I've got a lot of younger siblings, there was a little hesitancy at the start too, because it's something new, it's something that's now mandated, for everyone, that there
yeah,
was hesitancy. I think, like we've listed about the myths and perceptions, and that could be reasons why people were hesitant. I think
yeah,
the more you speak to people who have been vaccinated, it puts your anxiety at ease,
yeah.
because once people in my family saw that I got vaccinated and that didn't have any side effects, I think it helped them. So once you
That
know that
yeah
someone
help
you
you.
know
Yeah,
has been vaccinated, I think it really does help with your anxiety. And so that's my answer to that question.
yeah, yeah, yeah. That's definitely true. Yeah, I would say yeah. Not only people from the South Sudanese
Mm-hmm.
community background that are hesitant about the COVID-19 vaccine, because I have also met a lot of multicultural people that had their own beliefs in not getting the vaccination, and yeah, and they just felt like it wasn't safe for them to get vaccinated. Yeah.
Mm.
So tell us more about your experience if you are vaccinated. Um,
Okay.
I could,
Oh, did you want to go first?
yeah, I could start with mine first, or you. I don't know either. Okay,
You're
I'll
free to
go
go.
first. Okay, I'll go first. So, basically, with me, like I have been double vaccinated. So my first experience with the COVID vaccination, like I got the Pfizer vaccination for both. So the first time I got the vaccination, I mainly got a swollen arm, and I had a little bit of a headache. But the headache
Mm.
only lasted, I think, for 2 days. I took some Panadol, and yeah, 2 days, like the headache went away, but the sore arm, continued for some days, and that was okay. Like it went away. And apart from that, yeah, I didn't really have any severe symptoms, like apart from the headache and the sore arm. And the same thing also with the second dose. I basically only had a sore arm and no headache at all. So yeah, basically I had. I think my experience with the vaccination had been good. Like I haven't really experienced any bad symptoms like that some people could have experienced. Yeah. And what about you,
Thanks.
Adil?
Yeah, so the first day that I got vaccinated, yeah, it was the sore arm. I think I did have the mild headache, and I did take like you, Nurofen, or I think it was Panadol,
Yeah.
and I think there was maybe the second day I did have like hay fever, but it was also hay fever season. So,
Yeah.
but I think the thing to also say is that if you're feeling generally unwell after you get vaccinated, if you're having, symptoms like very bad cold and flu, fevers,
Yeah.
it is important that you go to your GP and say that you have gotten the vaccination.
Yeah.
Just it's and also I think if you've gotten any emergency situations like you're having heart palpitations, any cardiac issues, just call the emergency number 000,
Yeah.
because it's still you're still getting medical procedure, the
Yeah.
vaccination. So if you are feeling unwell, and it's just call 000, because there are
Yeah.
people who do get side effects from it.
Yeah.
Nothing's ever perfect. So if you're feeling unwell, just make sure you get medical attention. But like you, my experience was good, and
Yeah.
not everyone's experience can be good. So just make sure you take care of
Yeah.
yourself.
Okay. That's a really good advice there, Adil. So yeah. So another question for you, Adil, that has popped up again from the Facebook. So Adil, you have talked about anxieties. So do you think COVID-19 has impacted on young people and parents' mental health?
Oh, definitely. With young people, I'm more of the young adult group now, but even I have been impacted with the COVID-19, with everyone being isolated.
Yeah.
You are closed into one space, there's less
Yeah.
places to go and socialize. You do end up being very indoors. And with me, I'm happy being indoors, but even I felt like I needed to go outside.
Yeah.
But so with the mental health, it does leave you feeling very closed off, isolated. You are more anxious. There's some uncertainty with what's happening. If were in school, now you're
Yeah.
just homeschooling. If you're at work, maybe your hours have been cut back.
Yeah.
So I think that did leave a lot of
Mental
it
health.
just weighed a lot of mental health issues. It weighed a lot on people's minds. And with parents too, if you're at home more with maybe siblings and parents, you are finding that you guys may be clashing. There's just a lot of people maybe in one space. And I
Hmm.
guess we're all sort of bouncing off each other and maybe replicating poor energy. So I've, felt that as well,
Yeah.
especially if you don't get a time to have a break
Yeah.
and catch up with other people. So it's very important that you find outlets for it. A lot of people have, and I've done, exercising, going for walks, even, meeting up with people now, making sure that you have contact outside of your family. It's very important. Talking
Yeah.
to people how you're going, and having breaks is really important. Even having a
Yeah.
break from social media, because I found myself spending hours, days watching things online, and
Yeah.
sometimes they weren't, very positive things. They're just,
Hmm.
so it's very important that you guys have breaks and, make sure you plan what you're doing. That way, you know that, okay, I've spent time on this, I've spent time on that. I think if you leave space, it helps.
Hmm. Yeah, and that's very true. I also think it has had, a lot of impact, like mentally, like on a lot of young
Yeah.
people, the parents and even the elderly people, So like staying indoors and it's yeah, like with my experience, it had been kind of a bit hard, like a bit tough, trying to juggle studies and having a little one and yeah,
Yeah.
and I also felt like it must have been even way harder for those people, those people that have families, big families, like this, they had to readjust to homeschooling and all of
Yeah.
that. So yeah.
Yeah, that's true.
Okay. Okay. Another question. So do you embrace? Okay, where is it? Do you embrace Australian government? What? Do you embrace Australian government, both state and federal, are doing a great work, and how do we support them as South Sudanese community? Um, as South Sudanese community to be able to get our people to get vaccinated. So
Well, oh, sorry, did you want to say something?
yeah, okay, yeah. I'll give my perspective. So yeah, I think the Australian government and both both state and federal like have done a really amazing job like with how they handled the COVID-19 pandemic. Like if they hadn't put the measures they had put in place, it could have gotten worse. Like, the other countries where, COVID-19 has did get really worse. And yeah, so I feel like they did do a great job, though it could have been, a bit stressful with, with the numbers of lockdown we had to had to have, like
Yeah.
in order to get back on track and all that. But yeah, I feel like they really did do a great job. And, as South Sudanese community, I think we would be able to support them by, getting vaccinated and doing our part. Like, yeah. So what do you think, Adil? Like,
Yeah, I think Australia and especially Victoria are probably known worldwide now because of our lockdown measures.
yeah,
And like you said, we don't we couldn't have foreseen how long the lockdowns would have been. But
yeah,
I think now with the measures that we have in place, it looks
yeah,
like where our sacrifices may have paid off and where we've got a roadmap out of this.
yeah,
I think the South Sudanese community can support um, the government, at least by having platforms like this and making sure we discuss, and I think that's the most important thing, is that people who do have questions aren't, feeling that they have to be quiet to come to communities, groups, either online or on, a physical platform, on a physical environment, to share their concerns. I think that's the best thing we can do, because that way, if we discuss and talk about it, then we can make conscious decisions. So I think that's the best way for us to do it, for us to discuss it, and then put things in place, actions that we can do. I think that's how we can support our government. Oh, I think you're muted again.
Yep, yeah, it's totally. I do agree with that. So yeah. So we're just gonna. Sorry, my daughter.
It's okay. I'll read Mabila's next question.
Yeah.
If you'd like, it says,
Yeah.
Adil, as a registered nurse, what do you think we can do for young people who are resisting to get vaccinated? We can't force anyone to get vaccinated. So, like I said, having platforms like this and maybe inviting young people who are resistant to getting vaccinated to platforms, going to places, in a public environment and talking face to face to see what their issues are, I think is the best way, because just like them and like me, we've all had experiences where we don't want to do something. So, and the best way we go about it or turn around and say yes is by talking to someone who is receptive to our message and able to listen and hear our opinions. So that's the best way we can to young people, because I've known young people in my family who are resistant too, and it just involved me chatting with them and seeing where their issues lied and answering as best as I could. So I think that we can always just try and do that and see where we go about that. So yeah.
Okay. Yep. Okay. So we're gonna try to wrap this up and not get too long. So, okay. So yeah. So we can all protect our families and friends and community. So we can do this, by getting vaccinated or like doing social distancing and getting tested whenever you feel unwell, like. Yeah, because COVID-19 symptoms could be the same as like the flu symptoms. Yeah. So so our economic and social life can recover and more quickly return to normal if people choose to get a COVID vaccine. However, as the Victorian Department of Health rolled out vaccination to all Victorians, everyone needs to keep being COVID safe. So the Victorian Department of Health is vaccinating Victorians at high risk, including those working in hotel quarantine and frontline healthcare workers. But all Victorians will be able to get COVID vaccination in 2021, which has already happened, and we have already reached the target of 90%. But everyone, especially young people, can help stop, the spread of COVID-19 by making sure they get, the COVID-19 vaccination. And so, yeah, this is all, the information we had today that, we wanted to share with the young people. And yeah.
Yeah, great.